Hello, everybody. I'm very pleased to introduce Alicia Carranza, one of our classmates. She's very interested in her community. She works in Orange County in the health department on tobacco prevention. But this morning she is going to talk to us about how to get to the roots of poor health. That includes abuse prevention, uh, and she will be dealing with this topic with us this morning. We are very thankful that she readily accepted to be our presenter this today.
Great.
Alicia, your turn.
Okay. Thank you, Abel, and thank you, Dr. Dos Santos. It is a pleasure for me to be here to chat with you all today about this topic. It is definitely something that I'm very passionate about, and I think is something that's important to address with preventive care. Okay, so again, my name is Alicia Carranza, and I'm going to be talking to you about abuse prevention in Orange County. But before we begin, I'd like to invite everyone to participate in an activity that'll help us to get ready to be present with each other for the next 60 minutes or so. If you don't want to take part in it, there's not a problem. It'll just be about 5 minutes. So sitting in a comfortable position with your feet flat on the ground, silently to yourself, name 5 things that you see in your environment right now. Name 4 things you can hear. 3 things you can touch or feel with your body, inside your body. 2 things you can smell. And 1 thing you can taste. Great. So hopefully we're all feeling a little refreshed from that. And just a quick overview of what I'm going to be talking about. I'm going to briefly go into the overview of what abuse and ACEs are. I'm going to touch on the work that's being done in Orange County to directly prevent trauma and abuse. And then I'm also going to share some information about work being done in the county around trauma-informed public health services. So there's different types of stress. Stress can be acute or chronic. For acute stress, it's usually a short-term event. It can be something like when you hit your brakes in the middle of the road, or if you've had an argument with a loved one. This type of stress can also become episodic if these short-term events happen more regularly. However, some types of acute stress can be positive. Things like weddings, being in a doctoral program, those are all very exciting things and can give us a moderate amount of stress that really helps us have a sense of thrill in life and to keep us motivated as we move forward. But chronic stress is when a person experiences high levels of stress over an extended period of time. And it's also considered toxic stress because at this level, it can become detrimental to health. So ACEs are an example of chronic stress that can lead to overactivation of the stress response and ultimately poor health outcomes. Early adverse child experiences are stored in the hippocampus and can affect behavior and adrenocortical responses later in life. Moving forward, when we perceive a threat, our body responds by activating the hypothalamus, which then stimulates the adrenal glands to secrete stress hormones such as cortisol, catecholamines, and corticotropin. These hormones can increase our heart rate, our oxygen intake, our release of glucose, along with other physiological processes that get our body ready to fight, flight, or freeze. This is an adaptive response when there's a real threat present, but it can become maladaptive. Hormones are essential for the activation and deactivation of the immune system. Corticotropin stimulates the release of glucocorticoids, and brief exposure to these chemicals has been shown to enhance the immune response. However, when these levels increase, the immune response can become suppressed. Frequent suppression of the immune system can leave the body vulnerable to chronic inflammation, which has been associated with chronic diseases such as heart disease, diabetes, and arthritis. Toxic stress can impact our health across the lifespan. Studies on ACEs have found that babies can experience developmental concerns, children can experience increased infection, adolescents can engage in risky behaviors such as smoking or vaping, and adults are more prone to physical and mental health conditions. The higher the ACE score, the higher the risk. For example, adults with 4 or more ACEs are twice as likely to develop heart disease, 3 times as likely to develop COPD, and twice as likely as to be obese as adults with no ACEs. From a recent survey conducted across 25 states in the country, nearly 2 out of 5 adults report experiencing at least one ACE. And for those who are experiencing 4 or more ACEs, they're about 1 in 6 adults that are experiencing. So preventing ACEs could have prevented nearly 1.9 million cases of heart disease, 2.5 million cases of overweight and obesity, and 21 million cases of depression. These are 3 chronic conditions that plague many people in this and there's 5 out of 10 leading causes of death that are associated with ACEs. But the good news is that ACEs are preventable, and we can use trauma-informed principles to mitigate the effects for those who have been exposed to them. So some of the strategies include increasing resiliency, increasing awareness, screenings, and implementing trauma-sensitive services. And so now I'm going to go a little bit into more about how these strategies are being practically applied within the County of Orange. So there's one organization that's currently engaging in these strategies called the Priority Center. They are formerly known as the Child Abuse Prevention Center. And this organization offers direct services to address ACEs. And there are things like parents participating in the reunification process, which includes parenting classes. They do offer preventive services as well that are housed within their family resource centers, which are located in various locations throughout the county. These FRCs provide services and other resources to support children and families in meeting their basic needs, which can help prevent ACEs such as neglect. Another organization is the RAISE Foundation, and they lead abuse prevention in the county through a mix of education, advocacy, and comprehensive services. To help raise awareness and advocacy around the issue, they host events in April around Blue Ribbon Month, which is also known as Child Abuse Prevention Month. Their comprehensive services are offered as well as the priority centers through the FRCs. These centers are located in places like schools, but there's also mobile FRCs that actively go into communities that have limited access to be able to get these resources to them. Per the California Welfare and Institutions Code, every county is required to have a child abuse prevention council. And in 1974, the RAISE Foundation was designated the official council for the County of Orange. On a quarterly basis, this council brings together stakeholders from various disciplines, social services, law enforcement, and the medical community to collaborate on improving services and community support for prevention, detection, and treatment of child abuse and neglect. They recently held their conference, and it had some of the members that you see on the screen today, like First Five, Chalk, and Mind OC Be Well. In addition to this, they are also part of the ACEs grantees under the Surgeon General's ACEs Aware Initiative. And the first round of grant focused on educating and training healthcare providers on the new ACEs screening and workflow developed under this campaign. Prior to COVID, they were doing in-person trainings regularly. However, with the pandemic hitting, everything transferred to online. And so during the pandemic, they have been conducting 1-hour monthly trainings with these providers, which is something that's in addition to their 2-hour mandated training in order to bill for these. And they have had some accomplishments, like being able to train nearly 3,500 professionals over this last fiscal year, as well as providing CEUs for these professionals for their commitment to wanting to advance their practice. In the upcoming round 2 for their grant, they are going to be focusing more on the community, more consumer-driven, engaging around prevention. They're also going to be trying to engage more non-traditional healthcare providers. So outside of the family practice and pediatrics realm, for example, they will be training physicians assistants at the Marshall B. Ketchum University on the ACEs screening. One reason being that they are noticing many community members serve aren't seeking traditional medical care. They're not reaching out to large institutions such as Hoag, but more looking at alternative types of. And in addition to that, they will be continuing to work on their Anaheim network of care, which partners with a variety of organizations to help meet the needs of the community, to really kind of move up on that Maslow's hierarchy, to be able to get their basic needs and then work on more other. So trauma-informed public health is something that can also help with ACEs and trauma. And one thing that we're doing at the Tobacco Use Prevention Program is working with behavioral health service providers. And they actually were kind of the impetus to us embracing trauma sensitive lens for counseling, for sedation counseling, because it was something that they had requested. So we responded to their need. And in our toolkit that we developed, we included things that help them focus on this idea of using a trauma-informed lens when engaging individuals around tobacco use, particularly because it is so prevalent among individuals who have been exposed to trauma. This was very important for us as well to support the idea that the ask, advise, and refer model would likely need to be repeated with clients as their motivation shifts and wanes, as well as their readiness to quit. And so keeping that in mind and using this now trauma-informed lens will hopefully aid in. We also wanted to help infuse and educate on how to use SAMHSA's trauma-informed care principles, which include things like safety, transparency, and empowerment, and really give them tools also on how to use the 4 R's of sensitive services to engage clients around tobacco use and cessation. So just realizing the impact of trauma and creating a non-stigmatizing environment, particularly with tobacco use, this is a very big concern around the stigma. Recognizing the signs and symptoms of trauma and learning to build trust with the client. Again, quitting is a multiple attempt process in many instances. And so really building that trust with that client is important. And using that type of trauma-informed sensitive approach can help, as well as responding by fully integrating this knowledge within policies and practices. And so that's something that we're trying to do through this toolkit. And then resisting re-traumatization. So really maximizing control for the client. And one way we do this is through information that we've given on nicotine replacement therapy. So giving the client the ability to explore and see which of those 7 tools is effective for them can be one example of that. Additionally, we wanted to advise them on some potential impacts of trauma on nicotine withdrawal, as well as some ways to mitigate that with combination NRT and other resources. So there's also an important connection between our diet and our mental health. And our diet potentially impacts our mood because about 95% of the body's serotonin is stored within the gastrointestinal tract. Leia's Pantry is a nonprofit organization that has been focusing on using a trauma-informed lens with nutrition. So they have designed a curriculum called Around the Table, and it builds on nutrition, food, and cooking literacy while integrating social emotional learning and trauma-sensitive facilitation. So some of the same principles that we included in our toolkit are similar to what Leia's Pantry uses in their curriculum, such as the SAMHSA's trauma-informed principles. And they also use one of the most foundational pieces is the neurosequential model. So looking at how we can regulate our physical sensations to allow us to move up to relating to others and creating those connections, to give us that opportunity to engage with our reasoning brain to be able to learn those new skills and material. And so that's a thread that's woven throughout the curriculum for Around the Table. This is something that I'm actually working with Leia's Pantry and exploring through Orangewood Foundation here in Orange County to offer this to some of their transitional age youth who are aging out of the foster care system. They are currently working on a new foster parent curriculum. So hopefully this is gonna help inform that for them as well. And in addition to these 2 areas, The Orange County Department of Education is also looking at social emotional learning and how that can support really just the whole health of the child. And so they are ingraining trainings within not just for teachers, but also for other administrative staff, as well as for other partners that work with the youth that attend those schools, such as our program. And so to conclude, I just want to emphasize that ACEs are something that are preventable. And even for individuals who have already been exposed to trauma or have experienced ACEs, there's trauma-informed approaches that we can take in public health to help mitigate those effects, as well as to help make our programming more effective, more open for these different individuals. And so at our program, the Tobacco Use Prevention Program, we are trying to integrate some of these trauma-informed principles in our tobacco cessation work. We are also developing a second training staff really integrate that more with the actual practice of the AAR model. So thank you so much for your time and attention. Again, I really appreciate the opportunity to talk about this subject today. And please let me know if you have any questions.
Thank you so much for that very informative presentation. You mentioned that you do work with the tobacco ACEs patients, correct?
So we work with anybody within Orange County who smokes or vapes. Now, some of those individuals may have high ACEs, some of them may not. We don't screen for that within our department. We are more doing that with collaboration through behavioral health services.
I see. Are there other programs that will focus on other types of addictions other than nicotine and tobacco smoking?
So we do have other programs at the health department. There is an alcohol drug education prevention team called ADEPT for short, that's housed, I believe they're now housed under the Behavioral Health Services Agency, which is one of the branches of the health care agency. And they do programming around other substance use prevention, illicit substances, alcohol use prevention. I believe they're also doing things around marijuana prevention right now as well, and awareness. But in terms, excuse me, in terms of anything for other addictions like gambling, we don't have that any particular focus per se. In my conversations with behavioral health services providers, they do kind of address that within their programming, but there's not any specific program or department that addresses that.
Thank you. One more question. In the research that you have seen or maybe even conducted yourself, have you seen any particular type of food or nutrient that would be helpful to your participants in the program?
So do you mean in the in our tobacco cessation curriculum or one of the other programs I was referring to in the presentation?
So let's focus on the tobacco cessation one.
Okay. So the work that I've done here at the Tobacco Use Prevention Program has been not always direct cessation services. We actually have a county contracted provider called New Lung that handles a lot of that. So we haven't really done anything in that. However, when I was previously a health educator at one of the hospitals in Los Angeles, we did incorporate that as part of our curriculum. So we kind of looked at the connection between nutrition and weight gain, like post quitting and kind of the connection there. And we were able to highlight certain foods like milk, that if they're drinking that instead, that can kind of help on more of like a chemical level where they don't crave the cigarette because of the taste go together. Like what is pretty common for a lot of smokers is, you know, the cough or cigarettes and alcohol, because on a chemical level, those tastes pair more together in our bodies, if you will. But things like milk, fresh fruits and vegetables also, we try to encourage that again, because it's not only healthy, but there has been some evidence that have shown that it really does reduce those cravings for nicotine.
Interesting. Thank you so much.
I guess we have a lot of time here in our hands, so Any other questions for Alicia?
I have one.
Michelle?
Yes. Did you say how long that you have been working with the agency?
No, so I've actually been at the healthcare agency for a little over 4 years now.
Okay. And so I know that you have ongoing initiatives and things. Can you tell us maybe where you think like the next like public health advance or the next initiative or what you see is a public health challenge in say the next couple of years that you think that the agency should focus on?
I really like that question because it's something I have just out of interest been thinking about. And I really think integrating ACEs outside of the treatment realm is important for public health because we're understanding this connection between preventing them and preventing all of these poor health outcomes, chronic illnesses, early death. And so really kind of now housing that more in the preventive realm again, rather than just focusing on treatment, because I've kind of been in terms of my employment, my education, and my volunteer work, I've kind of been in the middle of both of those areas. And I think a lot of times, you know, there's a lot of talk about breaking down silos, but I think that's one of the biggest silos that needs to break down is really just integrating those to where there's more this continuum of care of using the 3 levels of prevention to really kind of help the community. I mean, a lot of what we do really at the public health level does prevent ACEs when we're working on policy systems and environmental change, you know, like getting people access to fresh fruits and vegetables, you know, like being able to create smoke-free spaces. But I think, again, I think just really starting to give a more concerted and focused approach to integrating a trauma-informed lens within all public health programming, not just cessation.
Thanks. That was a great PowerPoint too, by the way.
Oh,
Really
thank you.
appreciated that. Thank you.
Any other question? We are still open for discussions and we are all preventive care here.
I have another one.
Go ahead,
Okay.
Michelle.
So we are all in this public health program and specifically focusing on preventive care measures. And I am an educator too. And so I am always looking at things from these different lenses, but also with the lens of what does our curriculum need, or what can we add, or what can we adapt to what we already have to prepare practitioners to go in the field and address some of these issues. So what do you think that we might be able to add, or what are we doing now that could help prepare practitioners for like dealing with ACEs or dealing with some of these challenges that you brought up?
Yeah, I think that's important. I think I know just from some research that I've done on my own, medical institutions are a little more focused on that right now than let's say public health program, you know, at the educational level. But I think similar approaches of just really helping to educate students within their program on what are ACEs, how do they impact health, what are some strategies that can support the prevention of those. And again, I think just educating students on how to adopt a trauma-informed lens and really use some of those principles in their engagement. So I think health and wellness coaching is a really good example of that because it really highlights the non-stigmatization of conversations around health and people's behaviors. And it really emphasizes that client-focused approach. And I think trauma-informed, you know, work is really in line with health coaching principles. So I think really kind of fusing those together. And I think really even for health educators, having some type of health and wellness coaching, you know, curriculum or, you know, education within their, programs at the bachelor's and master's level is helpful, because I'm looking at my work as a health educator in the tobacco use prevention program. And over the last 4 years, I've been working with behavioral health services providers and clients. And that's a very specific situation, where there's a high prevalence of individuals that we're working with that have ACEs. But when we really think about it, if we're looking at the prevalence of this, everybody that comes into contact with other public health programs, be it nutrition, immunization, social services, they all may have ACEs. It's something that's pervasive in our communities, and, just really crosses those different lines. And so, again, I think really kind of giving individuals that approach gives them the ability to really engage people where they're at. And I think that's what the trauma sensitive approach is. And I think if students can be educated on it, I think they can be a lot more effective in their health education as well, when they become professionals.
And it would seem, just like kind of building on what you said, that we want to identify these individuals before we're getting to the treatment stage. We want to get to them at the prevention, and also maybe earlier in the treatment phase, so that maybe the trauma is not so well embedded, or it's not quite as severe, perhaps, maybe. So yeah, anything about early identification and screening, things like that, so that we're actually looking for this.
Yeah.
Thank you.
And kind of just in addition to your last comment, the ACEs Aware campaign at the state is really focusing on what you just mentioned, of both for children and adults to screen them, and then also really connect the dots of, okay, we don't just know now you have a high ACE score, but how can we help you? So they have a really nice workflow that they have developed for both, pediatricians and then practitioners that work with adults, to help them look at, okay, if they have this type of ACE score, they're low risk, they're high risk, and really what type of resources they need, again, to either prevent, further problems or, mitigate other ones. So it's a really cool initiative they have going on. Oh, Elizabeth, you had a question?
Yes. I was just wondering, ACEs, I'm kind of new at this, but I know that ACEs can be cyclical, like in families or maybe even communities. So what, aside from the schools, and what other methods of prevention are actually happening in the communities, or maybe even the schools, or like you mentioned, pediatricians screening young people or children? So what other ones are there to actually prevent this?
So that's a really important question. I spoke with the program director at the RAISE Foundation, who's one of the organizations I mentioned earlier. And one of the big focuses is on basic needs. One of the common ACEs that are reported is neglect. And so if you're not able to meet, your child's basic needs, food, it's not necessarily the parent not wanting to care for the child and actively neglecting them. It's not having access to appropriate supports and resources to care for their children. And so they do things like food distributions, to make sure that they're meeting those basic needs, connecting them to other economic resources, other programs that can maybe help with things like electric bills. So, going off of that basic need structure to kind of go back, further and along the hierarchy to be able to change those health behaviors. Another thing I kind of wanted to comment on was, I know you mentioned that, these type of ACEs really can be cyclical and generational. And that's absolutely true. I was recently trained about a year ago, I think it was now, to be a state certified domestic violence counselor. And that is one of the biggest challenges, is poverty is generational. Abuse tends to be generational. What one sees within their home environment tends to be what carries on. And so programs like Laura's House, which is where I actually received my training from, they do things around kind of that generational trauma. So they train other, advocates to really help, individuals that are experiencing those ACEs and, kind of get them to some immediate safety. Again, that basic needs, first approach. And then kind of going from there, they do also hold some health classes at their program, for their women that are in their transitional housing facilities. They also do some youth prevention work where it's teaching youth how to engage in healthy relationships and really the importance of healthy relationships to the rest of our health as well. So those are just kind of a couple things.
Is there anything being done in the schools though, so that we have more of a preventive method instead of a cure later on? Because if it's something's done early on, hopefully it won't be too bad later on.
Yeah, so I would say some of the things I mentioned are probably what's going on in the schools. One being the FRCs, the Family Resource Centers. Those are sometimes housed directly within the school, like the elementary school or high school. Some of them are separate sites, I believe. Some of them are housed in like community centers through the city. So those provide very much direct preventive services for parents. Again, it's really kind of getting at more of that basic need to prevent ACEs later on, giving them education. I think they also do some anger management classes, offer parenting classes. They also offer things now around developmental screenings. So making sure that they're screening the child for those developmental milestones at the school and making sure that they're connecting, the parents to whatever resources they need. Because again, that's another indicator that there's potentially some ACEs issues.
Oh,
And
that's
then,
a very good one.
yeah. And then at more of, I've seen this more at like the high school, junior high level. They're training a lot of their staff and their teachers around like trauma-informed approaches and social emotional learning. So, if students are upset, rather than, creating more of that authoritarian approach of, I said, do this, quiet down, really engaging with that student and really, exploring where those feelings are coming from in a very, I'd say simple approach. It's not therapy by any means, but it's more of just really kind of taking a second and being there present with that student. And there was actually a really awesome story from one of the trainings where the instructor did just that. Students were upset because some administrative decision that had come down that they weren't happy with. And the instructor told them, let's take a pause. How are you guys feeling? They had a couple comments and he said, let's write a letter to administration of how you're feeling. They were quiet for that entire time. Then they kind of did something a little, what they call like ritualistic, to kind of give the students that ability to kind of let it go. So they all stood up, they all walked
all in class, right? So
and
class,
threw it away and said, there's nothing I can do with this, but I'm going to be present and do my
class
best.
in those.
All the students did that. And right after, they were all ready to resume learning. No distractions, no hesitation, and they were able to move forward. So it's really, helping students, helping youth when they're feeling those emotions, kind of helping them self-regulate, teaching them those self-regulation skills to prevent what typically will happen after is unhealthy behaviors, lashing out, aggression or, high risk behaviors because they're not handling those emotions appropriately, or they just don't know how.
That's great. Thank you so much.
That's great. Yeah, I was wondering how preventive care would be involved on that. And well, in general, we don't have much interaction with children because our program is more focused on old adults but not because we want, but it's the tradition of the program. But I believe it's important for, I don't know, I think it's important, the screening is important for us, maybe not to intervene because it might be a little off our profession, but at least to refer if we see things. So that's how I see. To refer or to ask someone that is developing those programs if we have in our community and see what the interventions could be done for that. But it is an important issue, no doubts about that. Okay, guys, if no other questions, I will stop the recording, and then we have about almost 20 minutes, and then we can talk about preventive care. I mean, let me close here, stop recording.